I'll start. All right. Hello, everybody, and thanks for joining us on this very cold day that we rescheduled from another very cold day. So thanks for being with us. This February is American Heart Month, as you know, so I'm here to introduce Matt Carper to talk about that subject. Matt Carper has worked for Children's Nebraska for 7 years and is the Community Health Outreach Coordinator for the Community Health and Advocacy Team. He's serving as the interim Project Adam coordinator until Kim Castellano returns from leave. Prior to joining Community Health and Advocacy, he worked as Education Program Coordinator in Clinical Education and was the American Heart Association Training Center Coordinator, overseeing all the AHA programming for the staff at Children's. So welcome, Matt. This is a name that you might see over email. You might interact with them from time to time. So it's good to have him here so he can say hi and talk to you all today. So go ahead and take it away, Matt.
Thanks, Andrea. I appreciate the introduction. I'm glad to be here today. I'm going to share my screen real quick and we'll get started. Let me double check to make sure that's coming through okay. Can everybody see my screen? One thing I will say, I can't see chat anymore. So is there a way to...
I can mind the chat and just let you know if there's anybody that has any questions.
Okay. Then I will get started. So we're going to talk today about cardiac emergency response planning for school. And so we're going to talk through some things. A lot of what I'm providing today is information that I've worked on in my role with Project Adam. So we'll talk through some of those things, and I get some of the data from the American Heart Association, and we'll go through those as well. I do want to ask the group, and I was hoping to be able to see the chat. If you could type in chat, does any of your schools, do you do anything specific for Heart Month? Actually, I found chat. I see a no, we do not. Bulletin board. Gotcha. Blood pressure checks. Those are great for those that do something. Thank you for sharing. I am going to ask a few times during the presentation today for some input, so I appreciate anybody that's willing to chime in. If you've got questions throughout Heart Health emails and on social media, excellent. If any questions come up, like I said, I can see chat now. I'd love to hear from you, and then we'll keep going. But I did want to talk today about cardiac emergency response planning. Some things we're going to cover are just looking at ways to recognize and respond to sudden cardiac arrest. We're going to talk about what it looks like to develop a cardiac emergency response plan, which I'll probably refer to as CERP through most of the time throughout, because that's a lot easier to say. We'll talk about the foundations of conducting cardiac emergency response drills and kind of what we do after an event or after a drill with debriefing. So as I start, I'm going to show a video real quick. I will say that this particular video did have a positive outcome. It is going to show an example of somebody suffering from sudden cardiac arrest. The individual actually works as or helps with kind of the promotion with Project Adam now. Claire was a volleyball player in high school. We'll see here in a second. I just want to show this video of her situation. I'll play this real quick. And I do want to point out that if we go, well, I lost the video. I want to point out, we did see initially, she grabbed at her chest as kind of an initial response to what was going on and collapsed just a few seconds afterward. You saw as well that the team immediately jumped to response, and we'll go over a little bit more detail that the team's response here in a little bit. I do like to highlight that first. And then I do want to talk about, I think everybody in here is probably very familiar with kind of the difference between sudden cardiac arrest and a heart attack, where cardiac arrest is that electrical problem, that arrhythmia in the heart where things aren't quite firing off correctly, and an AED is going to be important to correcting that. And that's what we're going to talk about a lot today with AED use. But knowing the difference between that and the circulation issue that's a heart attack, I know from my perspective, I don't have a huge healthcare background. So when I first learned CPR, I'm not sure that I intuitively distinguished between the difference between the two. So this is something you could definitely take back to your teams to talk about, what's the difference? Why do we respond maybe and focus so much more on the AED with cardiac arrest with adolescents that are in our schools. So I wanted to touch on that real quick, and then get into kind of the signs of what we're looking for and what you can teach to your staff, to your students about how do we recognize and then respond appropriately to cardiac arrest. So initially, some things you might look for. I think we saw that with Claire in that video. She put her hand to her chest and showed that Levine sign, that chest pain or chest discomfort shortly before she collapsed. We might also look for fainting or dizziness with exercise, any excessive fatigue or shortness of breath with exercise, and again, that chest pain or chest discomfort. While we saw with Claire that she went down very quickly, there were not a lot of like outward warning signs. This is still a clue and kind of a cue to your response teams that if you see those things, that's kind of that light bulb moment where this could be a cardiac arrest, and it's important to the time becomes a huge factor when that happens, and we need to respond appropriately, get 911 called immediately, start that chain of survival, and get the AED. I know with presentations, it wouldn't be a good presentation without a few statistics. So I do want to point out that this is something that the American Heart Association has published with recent studies that they see in the United States around 350,000 sudden cardiac arrests annually. And fortunately, it's not a huge number of children, about 7,000 that are younger than 18, but that still is that still is an alarming number that we're still seeing in our country, that we do see in our country, 7,000 plus children that suffer from sudden cardiac arrest every year. The unfortunate thing with this, when they did this study, these are out of hospital cardiac arrests, and 90% of those situations with those kids did lead to death. So some of the things that we're talking about today should help to increase that blue piece of the pie chart, and we want to get that number as big as we can. So I wanted to ask a question. The polling that I had set up is not working, but I'll ask you as just to type into chat. Between the two, between athletes and non-athletes, which population, either athletes or non-athletes, do you think is more likely to suffer sudden cardiac death as a result of sudden cardiac arrest? You can type in chat if you think it's either athletes or non-athletes. Athletes. Everybody's saying athletes. 100% saying athletes. And I bring this up because I think this may come as a bit of a surprise. There was a study done in the United Kingdom fairly recently, within the last few years, looking at sudden cardiac death in adolescents. And they were able to look at them after they died and examined, what caused this and what was kind of the makeup of that population. Out of the 756 kids that they were able to study, a large portion of that population were non-athletes. So I think when it comes to how we initially think of sudden cardiac arrest, a lot of the media coverage that comes about with these types of events are with athletic events. If you think back to Damar Hamlin in the NFL a couple of years ago, where he took a helmet to the chest and suffered cardiac arrest. He's been a huge proponent of helping pass the recent Heart Act. It's the athlete piece is at the forefront. I think that's what we think of first, but it's important to recognize that they might not be the most at-risk population, where this could happen to any student in our schools. So, and even looking at the data on this, the vast majority of these cases were the sudden arrhythmic death syndrome, which essentially means that there was no known underlying cause to their cardiac arrest. And most of these situations were related to folks that died at rest, or children that died at rest. So that might be a little different than what we first think of when it comes to sudden cardiac arrest. But knowing that this could happen to anybody, and that there's not always a rhyme or reason behind it, is important for you all to know, and to also take back to your schools, because it really outlines, well, how do we plan for this? If we only have AEDs in the gym and aren't able to facilitate, getting those quickly to classrooms, that might be a consideration of maybe we need to move our AEDs to different locations or reposition things, knowing that this could happen anywhere in our schools. All right, I have another question. This one is just kind of a yes or no. I'll have you type in chat, yes or no, if you and your school has a specific cardiac emergency response plan in place. Yes. All yeses. Does that mean I can stop now? I'm just kidding. No, I'm gonna keep going. Oh, I want nope on the stop or nope. Either way. So cardiac arrest planning is kind of what we're gonna talk about next. I'm gonna go back to, oh, my dog's interrupting now. I'm gonna go back to our video with Claire, and this is gonna show the response of the team. We know that once somebody goes down, timing is important. And you may have seen, if you've been to any of our Project Atom presentations in the past, or have listened to Kim Castellano or Dr. Sorensen, they talk about and relay the message that every minute that passes without defibrillation from sudden cardiac arrest decreases the likelihood of survival by about 10%. So timing is important. I do want to outline this as a good response to see how their team responded to the same situation. See, the time started when Claire grabbed at her chest. You can see that kind of in the lower right. There's some timestamps going on. The team immediately within or so seconds initiated the call for emergency response. Directing traffic, somebody to meet with EMS so they can get them to the right location. And they're starting compressions within about a minute. The AED pads are placed about 1:50. And the shock was delivered right around there. And then after that shock was delivered, they continued CPR, and ROSC was achieved at about 2 minutes and 30 seconds after Claire went down. Look at the timestamp now. So EMS arrives about 9 minutes, which is, and by all means, is probably a quick arrival time. And then from there, they transferred her to the hospital. I like to point this out because, like I said, I mentioned that timing is important. For your schools, I would ask you again, here's another chance to type something in chat. How quickly, if something were to happen at your school, how quickly do you think EMS can get to your location? How quickly do they usually respond? And if you don't know, that's okay. 5 minutes, that's excellent there. 5 to 7. Yeah, that's great for those schools. 5 to 7 minutes. That's awesome. Um, the situation with Claire there, 5 to 10 in some other schools, rural areas, it's longer. So it's going to vary depending on where you are, but again, that timing is important. If we think to the situation with Claire, if they had done nothing between that first, from when she went down to when EMS arrived in 9 minutes, there's probably a very real chance that she doesn't survive that. But they stepped in, and from that 3 seconds when, I'm going to point this out, that 3 seconds when she hit the floor, they immediately called the response to call 911. The AED was in place with, or arrived within 30 seconds, which is fantastic. They started CPR within a minute. The pads were in place, and the first shock was, or the one and only shock was delivered at 2 minutes. And I look at the, I mean, obviously this was a fantastic outcome. I even look at this to say there's opportunities where CPR could have been started sooner. The AED could have been analyzing sooner as well. So even within this very positive outcome, there's probably room for growth, and that's probably something they talked about with their team after the fact. But I mean, I don't want to take away from the very positive thing that happened there, but it's that timing is important. It's to get action in place as quickly as we can. All right. So we're going to go into cardiac emergency response plans, which you all said you have. So this is going to be probably a lot of review for most of you, but I do want to cover some things that we look for from a Project Adam perspective on how we put plans together. And hopefully that might prompt you to go back and look at your plans after this and maybe reevaluate them to see if you're missing anything or if things can be improved upon. Because with anything that we do, the more we look at things, sometimes we can get better outcomes. So some things we're looking for with CERPs is having a cardiac emergency response team. We'll talk about the details of that here in a second. Knowing your AED locations and documenting that within the plan. And then those specific steps that you would want to take in an actual cardiac emergency. We'll talk through some of those as well. With the CERT, with the emergency response team, it is important to designate a team coordinator. I'm going to guess for most of you that is you. For those of you that have those plans, which is everybody in this group considered your team coordinator? You can type that in chat. I'd like to know. Yes. Ah, excellent. And that's not surprising to me that you all take on this responsibility or were assigned this responsibility. Probably oversee all the training, any education, any other drills and ongoing evaluations of your plans. We strongly encourage that any CERT members should be certified in CPR AED training. I think it was the NSAA took a big step this year with this school year requiring coaches and activities sponsors to be CPR certified. So those are good team members that you could potentially lead on to add to your teams if you don't have people that are certified, or anybody else that can fit the bill to jump in and respond to these situations. It's important with those teams to designate specific individuals to quickly call 911 and direct EMS. I know from some tours I've done in schools, if we don't have somebody there to direct traffic, I know if I went to Westside High School and I was an EMS responder and nobody was there to show me where to go, I don't know that I could find my way through that school. And I'm guessing there's lots of schools that would fit that bill. So it's important to have somebody make sure that we direct EMS when they arrive. Some best practices I do want to talk about. It's important to try to have at least 5 members on the team, or around 10% of the staff. Members should be able to step away from what they're doing in cases of emergency. I would ask you as well, are there any groups of people that you may not include in your teams because they wouldn't be able to step away in any situation? Are there people in schools that would fit that bill that we probably wouldn't include? Some teachers? Okay. Okay, I like that. Katie, I like what you say about having a plan for coverage, because that's part of this as well. That if somebody steps away, that we communicate and make sure somebody fills that role. So if it's a teacher that needs to step out, who's going to fill in? And that should be outlined in that SERP. I can think of certain teachers, like industrial arts teachers, we're probably not going to put them on the team if there's heavy equipment that could cause issues in the classroom if somebody's not there to monitor. So those are things to think about, or maybe other folks that aren't regularly in the building. Also have a plan for coverage within MPS. Awesome. I think any of you in here work in multiple locations? Yeah, so for those of you that work in multiple locations, that if you're the team coordinator, maybe having a plan for each building when you're not in the building, if you don't have that in place already, because if you're not there and something happens, how are we addressing that? So it's important things to think about with your certs and your SERPs. Within the SERP, definitely want to outline locations of the AEDs within the plan. Those are things that if we have other people that use our buildings, that we can share those locations with them in case something goes wrong and they need to utilize an AED. Wherever we place our AEDs, ideally they're in locations that if something happens in your building, an AED can arrive on the scene within 3 minutes based on those timing needs. So just make sure that as much as you can, if you have the resources to place AEDs appropriately, go through it and do that. All right, then within the SERP, I'll show you here in a second a template, an outline of a basic SERP. Important to really outline the steps and a recognition of the need for CPR and how CPR started. Outlining rules for the activation of the emergency response, who calls 911, who gets the AED, who directs EMS, spelled out that how to utilize the AED upon arrival, make sure that's spelled accordingly, and any other roles that need to be assigned through either documentation, EMS coordination, and then just make sure to continue CPR and AED until EMS takes over. So I do want to show, here is an example, and this is something that Project Adam did develop. And we have templates that if anybody would like any of those or would like more information about Project Adam, we can definitely provide those after the fact. But I do want to point out, so we look at the school and the CERT team information, make sure that's all spelled out, because when an emergency happens, sometimes we forget important information. So if it's written down somewhere, it's going to help whoever needs to communicate and call 911 to make sure and give the right address, things like that, in right locations. The AED locations, we want to spell that out as well. And then you can notice between that too, directions on who to call, how to call EMS in case of emergencies. It may not be. And do you have any schools in here that don't call 911 directly? You have to call a different type of number, or like dial 9 to get out, something like that? So if it's standard call 911, you can still obviously spell that out accordingly. And then those steps that come into play when you need to respond. It is spelled out pretty specifically, is that it says first responder calls for help, then the first responder begins CPR. Some of this is probably second nature to us, but if we aren't regularly versed in CPR or aren't as familiar with this, it may be important to spell this out step by step for members of our team, so that when they review this, it's just a quick reminder of, okay, here's what I do when, here are the steps, here's what we need to accomplish. All right. We're going to continue. So drills are really the next step once you have your cert and your SERP in place. Drills to me are probably the most important part of this whole process because it really puts into action everything that we've planned for. So some things to think about when planning a drill is essentially, and we'll go over each of these in a little bit more detail, when you're going to have it, who needs to be involved, what supplies you need, and where are you going to have it. Out of this group here, I'd be curious. I know some of you for sure, because I recognize some names, are Project Adams schools and you've done drills. Who all in here have done cardiac arrest drills in their schools? You can do yes or no. Yes. A lot of yeses. At a couple schools. That's great. Was the first one intimidating? Resounding yes. Yeah. So, and again, this is absolutely. First one's intimidating. Did it get easier after, if you've done more than one, is it easier since doing the first one? Yes. Easier. Good. So I'm going to go over some things you probably already know, but it might be a good refresher and some things to think about future drills and maybe some things to bring into future drills as well. But as a reminder, when we conduct, yes, but prepped for the first one, we'll do unannounced later. Awesome. I like that. Especially for the first one, give your team some notice. I would not recommend doing an unannounced drill if you were doing the first one, but all of you have done this. And allow your team time to review the SERP and any of their roles. Even for an unannounced one, maybe it's, hey, we're going to do a drill next month. Double check what your steps are, just so things can go smoothly. But that, again, that's up to you. It can take place with or without students present. And I would encourage you, if you've not done this already, to try and incorporate students as your comfort level grows. Anybody in here already incorporating students into their drills? Did. Yeah, Katie, a bit traumatic for an elementary student. That can definitely be the case. I did a health fair a few weeks ago and there was a young student that came through and her sibling had passed away in the hospital recently, and there was a lot of CPR associated with that, and that was a bit of a trigger for her, which was an unfortunate thing that we don't always think about and consider. So those are things to think about. If you can incorporate your students in some capacity, that's great. I know I'm gonna call out Katie Thompson here. She was, prior to joining our team as our school health manager, she was the school RN at Creighton Prep, and I know that she incorporated her students into training, which was a big step that we were very proud of her for doing that. Any other schools, do you train your students in CPR? Whether or not it's an actual certification or just getting them basic knowledge and practice. Does anybody work with their kids on that? Some are certified. A little bit, some yes, some no. That's okay. That's good. Yeah. Elementary, yeah, elementary can be a little bit tougher. But again, things to think about when it comes to doing drills. How do we, all ninth graders, excellent. How do we get kids more involved? Because they might be, if something happens in a bathroom and I don't know. I'm guessing teachers don't go into bathrooms, but I'm not sure. And nobody's there to witness it. It's important for them to recognize something might be wrong and they need to go and get help. So as much knowledge as we can get out, the better. All right, so who to involve? So the site coordinator is going to really lead the charge. And then obviously the emergency response team is going to be part of the drill itself. Important to have somebody record kind of the timing of the drill, because those are things that we're looking at, and somebody that we're going to designate as the finder, the person that finds the mannequin. And then EMS, if you can get them involved, I think that's fantastic. But that is something that should be pre-planned and spelled out pretty specifically on how we contact them. When I first joined in support of Project Adam, I was fortunate to be able to go to the two Bellevue high schools, and they were a good example of when they did their drills, they incorporated calling EMS. And I think I saw Sue in here. I feel like I saw her name. I could probably speak to at least from what I saw, it was so helpful to their team to be able to practice that handoff with EMS and practice that communication, practice guiding them to the scene. And I think as much as you can get EMS involved in these, the better, because it's just going to make people more confident and comfortable with what they're doing. But again, that's something that's pre-planned. How you call that in is important. So it's talk with your EMS groups if you want to involve them in any drills that you run. And then drill supplies, pretty straightforward, but whatever communication devices that you use, having an AED, your actual AED, making sure that that's something that's grabbed during the drill. The mannequin to do compressions and put the AED pads on. A training AED should be used once the real AED arrives, and then your drill checklist and a stopwatch to record time. For locations, definitely recommend practicing at a different location each time. It's good to see on paper, if something happens in one corner of the building, how long does it take an AED to get into place? If something happens in the football field, how long does it take to get the AED put in place? So practice at different locations, try things differently, different times of day, whatever you can to thanks, Sue, for sharing that. EMS also appreciated being part of the drill because that's good training for them as well. So it was a mutually beneficial situation for both teams. So yeah, different locations, keeping those in mind. And then basics for this, I'm guessing you've already done this already, but whoever's coordinating the drill, put the mannequin out at your designated location, have the recorder nearby. From then, whoever's designated as the finder would initiate the response upon finding the mannequin, have the team grab their real AED, and then you as the coordinator have the training AED handy. So when the real one arrives, you would hand off the training AED to the team to utilize that for practice. And then if EMS is utilized, I'm skipping the steps. If you don't utilize EMS, recommend at least 2 rounds of CPR and AED use, which should be about 5 minutes or less. And then if EMS is utilized, you would continue with the whole process until they arrive. I think it was at the first Bellevue High School I went to, going back to that, I think one of the administrators that was part of the team got looped into doing about 5 or 6 minutes of CPR on his own. I think he was definitely worn out. So that was an opportunity to think about how we switch between rescuers every couple of minutes as we go. But that's why drills are fun. That's why they're important, because it helps us pick out room for improvement. Here is an example of a drill checklist that we can utilize. Really important at the top of this particular one is to focus on those timestamps, so we can know how long it took for from the discovery of the victim to when whatever the announcement is called out, how long it takes for CPR to get started. when the AED arrives at the scene and how long it takes to get the shock delivered. Again, our goal with this should be, and this is something that Project Adam preaches, is that shock delivery should be within 3 minutes or less. And that's something we can outline in the drill. I will say on all these other points, these don't all, if we're going through a drill and all these aren't yes, that's not the end of the world. If some of these are no, those are just opportunities to give feedback to your teams and look for room to improve. I would rather see discussions and see room for growth in a drill scenario, and that will make you better prepared for an actual situation, so you can learn from that. I am going to show another video of an example drill now. Let me get to the right timestamp here. We're going to watch this and then watch through kind of a debriefing situation. This one is a few minutes long, so we'll watch through this. I'm keeping an eye on our time too. Oops. Okay.
Are you okay? Are you okay? I'm starting compressions. 1, 2.
Code blue to the gym, please. Code blue to the gym. Code blue to the gym, please. Code blue to the gym at this time.
I've got the kids. Kids with me, come on. I'm relocating the kids. You're safe. Let's go, guys.
Code blue, the gymnasium. Code blue, the gymnasium. E-team, please report to the gym.
1, 2, 3, 4, 5, 6, 54, 55, 56, 57, 58, 59, 60. 1 and 2.
Okay, faster.
13, 14, 15, 16, 17, I'm going to cut the shirt. 19, 20, 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. All right, clear. Let me take the shirt. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 28, 29, 30.
Do not touch the
Do not touch the patient.
Analyzing heart rhythm. Do not touch the patient.
clear, stay
Analyzing
clear.
heart rhythm. Shock advised. Press the shock delivered. Begin CPR.
1, 2, 3, 4, 5, 6, good compressions. 7, 8, get ready 9, for 2. 11, 12, get ready for 2 breaths. 15, 16, 17, 18, Shown first cycle. Get ready for 2 breaths.
20.
Press down the mask. Lift the chin. Go on up. Good chest rise. Ready? CPR is in process. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. Good compression. Drop.
School Board 6102. I need fire rescue on a 3 to John A. Ferguson. Reference a medical emergency. CPR has already been started by staff.
Good compression.
Stop CPR. Do not touch the patient.
Stop
Analyzing
CPR.
heart rhythm.
They're analyzing.
Do not touch
the patient.
Analyzing heart rhythm.
They've given
Shock
1 shot.
advised.
And be careful.
Do not
Watch
touch
out
the
for leg.
patient.
Do not touch the patient. Stand
Everyone
clear.
clear.
Stand clear.
Press the
This is the
flashing
second
shock
shot.
button. Shock delivered.
We're gonna go back on
Begin
compression.
CPR.
Here we go. Ready?
And go. 2. Deliver 2 shots. Giving compressions right now. Another rescuer is coming.
20.
First rescue. What number are you on?
30.
Okay.
30. Give
Good
2
chest
breaths.
rise. Good chest rise. All right. Good. 30 more. Good compressions. Stop CPR. They're going to give it a check. EMS has arrived. We've got to keep going, guys, until they get here.
We've been giving CPR for about 8 minutes. We shocked him twice. He collapsed during the basketball game.
Okay, perfect. Thank you. Check for pulse. No pulse. No pulse. Start compression.
All right, I'm gonna pause that here. So we're gonna talk about debriefing next. We do like to focus on the positives first. And obviously, this is a great example of a drill. But what are some things that you all saw that went well during that drill? If you could type those in chat. Communication, preparation, communication. Counting out compressions, switching, they were calm. Starting CPR immediately, continuing compressions, didn't panic. Yes, all very good. And those are all things that we want to point out first. Even if there's room for growth, focusing on the positive first. I'm going to show you a quick example of their debriefing after this. So some things that they're going to point through or point out. 1 second. Stopped the video too early the first time. I have a timestamp wrong. Okay, here we're going to get into the debriefing.
All right, guys,
Very quick.
let's do a quick debriefing. What do you think went well?
I'll start. I think that we recognize that there was a true emergency. I feel like the kids really helped out to notify the front office and get the Code Blue team in action.
In reviewing the checklist of the drill, I must commend the team for the open lines of communication and the timely response. We definitely initiated the AED within the 2 minutes, under 2 minutes, so good job there, making sure that from drop to shock, we acted as promptly as we could.
All right, guys, so let's go over your AED. It's always very important to make sure you familiarize yourself with your AED. It's not the same as the trainers. I do just want to make sure you guys are aware how to turn it on. It is all you got to do is just make sure you open it and you go ahead and know that you follow instructions, okay?
All right. I do like to point out, so I liked the piece at the end as well, where she went through the differences between the training AED and the actual AED. So if you have in your school, if your trainer is different brand than your real AED, it is important that you let your team know specifically how to use your actual AED, because it might work a little bit differently. But definitely always you want to conduct debriefing after drills. It's as simple as it was a 2 or 3 minute conversation and talking through the positives. And then even if something wasn't 100% great, you can talk about room for growth as well. And then definitely if there's ever a real emergency, strongly consider going through a debriefing process after real emergencies as well. If you are a partner school with Project Adam with Children's Nebraska, I want to let you all know that we do have our team available to assist with debriefing for real emergencies if that comes up. We have our chaplains available and things like that, so we can connect on those pieces as well. Hopefully it never happens, but we recognize the importance of facilitating debriefing after an actual emergency, because those can be extremely traumatic events for teams, and they don't always know if they did things right or wrong, and sometimes they need some outside reassurance from other folks too. So I want to point that out. Some other things that you can talk about during the drill. Again, talking about what went well, what could have gone better. If there's things that were easier to remember, harder to remember, this is really your chance to, in a safe environment, talk through specifically what went right, what went wrong. And again, it's an opportunity for your team to learn. It's never a situation where we're using this to point fingers at folks. It's coming together to make things better. So if something real happens, your teams are better prepared to respond effectively. All right, so again, some components of that debriefing process, go over that checklist, review those timestamps, talk about what went well, if there's anything missed. If there were communication problems, that's a good opportunity to talk through that. Talking through feedback, discuss suggestions or concerns or any action steps. You may go through a drill and realize that something in your SERP doesn't work. And that's an opportunity to review your plan and maybe make amendments or adjustments. And then again, consider that review of your actual AED if it's different than your training unit. So any familiarity with the real ones, the better. So I'm about done. I kept things moving pretty quick today. Just in review, I do want to kind of point out some of the things that we talked about is that we focused on some recognition and response to sudden cardiac arrest. Developed how to develop a cardiac emergency response plan or a SERP, some foundation pieces of conducting a cardiac emergency response drill, and basics of debriefing. Does anyone have any questions? I'm going to stop the share here. I do want to say I appreciate, I was very happy to see that all of you are doing these things already, and I want to commend you all for the time that you take to make your schools safer. So thank you for everything that you all do, because it's important to your schools and communities. I'll say as well, if anybody could use any resources, templates, or has questions about Project Atom, we can get you my contact information. I'm happy to talk through some of those with you anytime.
All right, well, I think we'll go ahead and wrap it up a little bit early today, and that's okay. I'll go ahead and email out the CE code tomorrow or Friday at the very latest. And Connie, yes, thank you. And I do need to get back to you on that question. Connie, we will go ahead and give you the templates. But yeah, thanks everybody for joining. I know a lot of you didn't even have school today, so you're joining from home, and I just very much appreciate you being here and all the work that you're doing for Heart Safe Schools and just for all of your kids in general. Yeah, just thank you. And I guess we will see you next month. Appreciate it.